Welcome, everyone. Good evening, everyone. Thank you for joining us at this evening. This evening, we have Dr. Lim. We also have Dr. Umi in the house and Dato in the house. We have a few doctors here. But tonight, we have Dr. Lim as our speaker, and he's going to share about I hate glasses and what are the alternatives and the options, the safer options and alternatives. If you have actually followed us in our Facebook Live, Dr. Lim did share some sneak preview of this topic. So can I have Dr. Lim's profile? Just a brief introduction about Dr. Lim before let Dr. Lim to take over. So this is the topic we're going to talk about for tonight. I hate glasses. Can I have the profile? Dr. Lim's profile? Sorry. So for those who are joining us at the Zoom session, all right, I would appreciate that you will mute your mic during Dr. Lim's presentation so that we will have less interference and interruptions. So we will have the Q&A session later. You can unmute your mic and ask the question, have a direct interactions with Dr. Lim later on, okay? So at the meantime, during the session, if you have any question, you can also type into the chat room. For those who are joining us in our Facebook Live, you can also type in your questions in our the Facebook chat room. So we will address it during the Q&A session, okay? So Dr. Lim is actually our senior consultant in LEC, and he actually obtained his master in ophthalmology in University of Malaya Hospital in 2003. So he's also the head of department in the ophthalmology department in Teluk Intan Hospital in 2004. And he's actually an experienced and competent surgeon for cataract surgery with front guided LASIK procedures, intraocular lenses, procedures like pterygiums, as well as conjunctiva graft using the fibrin glaucoma surgery, which actually what we call is trabeculotomy, and then glaucoma management, as well the screen procedure and the eyelid procedure. So Dr. Lim is also a visiting consultant in Perak Community Specialist Hospital. So for during emergency, if let's say we are close at LEC Eye Centre, you can always go to Perak Community Specialist Hospital, the A&E. Our doctors will be on call during those times when we are not open. So Dr. Lim, without further much ado, let's welcome Dr. Lim. Hi, Dr. Lim.
Hi, everybody. Hello. Okay, so I'm sharing my screen now.
Yes, thank you.
Okay, I'll proceed my talk. Okay, just give me a second. Okay, so this is the topic of my talk today. I hate glasses. Okay, so why hate glasses? Well, some people hate glasses, but it can be for many reasons. Number one, it could be cosmetics. Some people think that they look, some people may think they look better without glasses on. And then others are like, for example, sports or leisure activities. Some of these activities, such as contact sports and swimming, well, it's not very convenient if you wear glasses. Okay, another reason would be occupation or career. Some occupations, for example, police or military or pilot, okay, they may not, you may need to be glasses free for this type of occupations. Okay, and then cost is also a factor, cost effective. Glasses or contact lens actually in the long run can actually be quite expensive. And then lastly, safety is also a cost. Sometimes in emergency situations, if you cannot like get your glasses, wear your glasses in time, there could be a safety issue. For example, like if you're asleep at night and then suddenly there's a fire and then you just can't find your glasses, and you're trying to escape. Well, I mean, maybe a bit far-fetched, but that's a possible scenario anyway. Okay, so before we go on with the rest of the talk, I think that you need to have a basic understanding of the structure of the eyeball. So yes, there are many parts labeled here, but I think we just need to know a few fleshy parts. Whole thing is the eyeball. So here is the pupil. Okay, pupil is that central opening at the front here. Okay, I'm sure everyone knows that. The very front of the eye, there's a very important structure known as cornea. Cornea is actually like a transparent membrane, which is like a dome shape, and it's the whole the front of the eye here. It's a transparent which allows light to pass through, and it also focuses the light onto the this retina. See here, this orangey colored layer behind the eyeball is called the retina, and at the very center of the retina, you have this point here called the macula. Okay, macula. So macula is where all the light or the images get focused on. It's at the very center of the retina. So to have clear vision, light must pass through your cornea and through your lens, and finally the light must be focused exactly on the macula, to get a very clear image. Okay, and then from the image here, the signals are transmitted via your optic nerve to your brain, which will then interpret what is the image that you are seeing. Okay, touching on our topic today, I think you also need to understand what are refractive errors. Okay, refractive errors are actually comprises of I would say three main things here. So first is, okay, this is normal. Metropia is actually a normal state of refraction of the eye. Normal means that light that passes through the front of the eye, it gets focused exactly on your retina here, exactly on the retina. See, it comes to a point focus right on your retina. So a person who is so-called normal without any short-sightedness or astigmatism, the light passes through and gets focused exactly on the retina. So they will see a very clear image. Now, the first group of refractive error is actually very common. The most common, I would say, myopia. Myopia would be commonly called short-sightedness or nearsightedness, or in Cantonese, they call ganzi. Okay, so in myopia, what happens? Light passes through the front of the eye, but instead of being focused right on the retina, it gets focused at a distance in front of the retina. So as a result, the light doesn't actually manage to reach the retina itself. So it just focuses on a point in front of the retina. So obviously this will cause a blur image to form on the retina. So a person with myopia or nearsightedness, if they do not wear glasses or any other kind of correction, they will see blur images for distance. Okay, the other group of refractive error is actually hyperopia, or what they call farsightedness. Okay, farsightedness, what happens is light comes from the distance, passes through the front of the eye, and instead of being focused on the retina, it gets focused at a point behind the retina. Okay, so in other words, it also doesn't form on the retina itself. So the result is the same. It's a blur image. Okay, they have a blur image. And then this last group here, astigmatism, or what they call san gong. Okay, this is light passes through the front of the eye, and then but because of different curvatures of the cornea, light gets focused at different points on the retina. Some may get focused on the retina, but other points may get focused in front of the retina, or some may actually go behind the retina. So the end result is actually the same. You get a blurred image. The person will see a blurred image. And because of all these different points of focus of the light, one other feature a person with astigmatism will have is the eyes will be sensitive to glare. If there's bright light and all, if they don't wear corrective glasses or any kind of correction, they will be sensitive to glare. Okay, so glasses-free options. So if you don't like glasses, or if you wear glasses and you're looking for a way to be free of them, okay, well, the most obvious glasses-free option would be, I would say, contact lenses. Well, we're not going to talk about that because I think the focus here today is on other methods apart from contact lenses, because a lot of people also do not like contact lenses. Okay, so the glasses-free options, basically, I would say there are three, okay? Second would be something called a Phakic intraocular lens, and third would be a pseudo-Phakic intraocular lens. So all these are maybe kind of complicated names, okay? But it's actually very simple. There are only three, okay? So later we'll go through each one, okay? So first is LASIK, okay? LASIK. Second is Phakic intraocular lens. So the word Phakic means that if you're this lens is actually implanted into the eye. Phakic means implanted into an eye which still has its own natural lens. Okay, so the word phakic means natural lens. So that means that this lens is implanted into an eye with natural lens inside. So the lens is implanted into the eye. Okay, the pseudo-phakic intraocular lens means that this lens is implanted into the eye after the natural lens of the eye. Okay, so it's I would say something like a cataract surgery. You remove the lens of the eye. After that, immediately you implant the lens inside. Okay, so the difference here is the phakic lens is implanted into an eye which still has its natural lens, whereas a pseudo-phakic lens is actually implanted into an eye of the eye. So why is there a difference? Why is there a need for different methods? Well, we'll go into that later a bit. Okay, so coming to the first method I mentioned for classes 3 is LASIK. So LASIK is actually a procedure in which lasers, surgical lasers, they are used to reshape the front curvature of the eyeball, basically the cornea itself, okay, to correct refractive errors, like what I mentioned just now, short-sightedness or astigmatism. So again, this is a diagram showing all the different kinds of refractive errors. So to correct all these refractive errors, usually when you use glasses to correct them, the glasses will be what do you call it? The glasses will be of a few types, namely like the concave or the convex shape, okay, or astigmatism glasses. So all this serve to actually like refocus the light properly onto the retina, okay, directly on the retina itself. So here in LASIK, what we actually do is we use laser to actually reshape the front surface of the cornea. So sort of like molding it. It can be said like molding it into the shape of glasses to actually correct the focus of light to place it right on the retina. Okay, see that's LASIK. We use lasers to actually resurface or reshape the curvature of the eyeball to refocus light properly onto the retina. Okay, so LASIK is well, unfortunately for everybody. LASIK is suitable for a very broad, I would say a large group of people. But then there are certain criteria that also needs to be met. Okay, so to be suitable for LASIK, actually these are the criteria. First, you should be at least 18 years of age, and not only that, you should be 18 years of age, and your refraction or your so-called power should be stable for at least 1 year. That means in the past 1 year, there shouldn't have been a change in your glasses. No? Your power should be already stable and have no further increment. Apart from that, the eye will need to be properly checked for any eye diseases. There should not be any eye diseases like corneal disorders, cataract, glaucoma, and other eye diseases. So that is why it's very important to have a pre-LASIK assessment or pre-LASIK. Okay, the other thing here is LASIK. Basically, as I mentioned earlier in the early stage, LASIK actually works by using laser to actually resurface or reshape your cornea. So obviously, you must have adequate corneal thickness. Okay, if your cornea is too thin, then you may not be suitable for LASIK. Okay? Because when you do a LASIK procedure, the laser will definitely remove a small amount of corneal tissue, okay, to reshape it. And then other things are generally your health you should be generally healthy, no diabetes or autoimmune diseases like SLE, okay, which are all I think more common in women. Okay, and lastly, that you should not be pregnant or breastfeeding. Okay, because all these when in the pregnant state or when you're breastfeeding, there are certain hormonal variations in the body which can actually affect your refractive power of your eye. Okay, so if you're pregnant or breastfeeding, you cannot do LASIK for the moment. Okay, this is actually a picture of a scan, an oculizer scan, or what you call a corneal topographer. So this is actually a part of our pre-LASIK assessment. So this scan or this machine actually oculizer, it actually scans your cornea, to examine the structure of the cornea, to examine the surface, not only the front face, but also pick up any kind of corneal abnormalities, any corneal diseases or disorders, okay, which may mean that you may not be a suitable candidate for LASIK. And this scan, during this scan also, we will measure the thickness of the cornea to make sure that it is enough for the correction your refractive error. So this is just part of our pre-LASIK assessment. Okay, the laser eye surgeries that we use to correct refractive error. The LASIK which I was talking about actually is what called wavefront optimized bladeless LASIK. Okay, so in this LASIK procedure, usually there is a flap. Later I will explain what they mean by this flap. The other kind of laser eye surgery is actually what called as ASAR, advanced surface ablation without a flap. In this procedure, there is no flap on the front surface of your cornea. It's just that these two methods is a bit different in the sense that one there's a flap and one there is no flap. So what do we mean by this? Okay, I will go on to the next slide. So this one here, I'm going to describe a LASIK procedure with the flap, the one with the flap. So basically what you have here is, okay, this is the cornea. Before we start, the cornea is like this, intact. Okay, the next step, what we do is a laser called the femtosecond laser, okay, which is completely controlled by computers. It will create a flap here. That means it will cut a very thin partial thickness flap, which is hinged on one side. It's not that we cut out a whole round button. We cut a round flap here, and part of it is still attached to your cornea. And after that, that flap is on a hinge there, and that flap can be just like flip over like the cover of a book. Okay, so now this flap is created by, as I mentioned, the femtosecond laser. Whereas previously, it was done using a microkeratome, which is actually a manual method. It's a kind of a metal, so-called mechanized blade, which the doctor holds in the hand and works it across the cornea to create a flap. But nowadays, the flap is actually created by the bladeless method, the femtosecond laser. So obviously, it's very much more accurate and safe. Okay, so after creation of this thin partial thickness flap, the second laser, known as the excimer laser, actually comes on, and it what they call ablates the surface of the cornea or the bed of the flap. You have removed the flap here, so this is the bed of the cornea here, and the excimer laser, the second type of laser, will actually come and reshape the curvature of the cornea to correct your refractive error. Okay, this is also a very fast process being completed in just mere seconds, definitely less than a minute. Okay, and then finally, when the excimer laser has done its job and corrected the refractive power, the flap is then just flat back again over the what you call the wound here. Okay, it's just like close the book cover again. So the reason for this flap is that this flap acts as a like sort of a protection over the area which has just been corrected by the excimer laser. Okay, so flap covering the wound, it will be very comfortable. The eye will feel very comfortable, okay, because there's a flap which protects that raw area from the laser. And this will also, of course, make the healing very much faster. Usually by the next day, all the patients, they're already very comfortable. And yes, they're already very comfortable and they don't feel anything. Okay, so this is the one with the flap. Now, the other one I mentioned, the advanced surface ablation, it's basically the same thing here. We use the excimer laser to correct the curvature or to reshape the front curvature of the cornea. But in those cases, in the case of the advanced surface ablation method without a flap, yes, without flap means that we don't create a flap. Okay, we start with this intact cornea here. Then we will just like scrape or remove the very front surface of the epithelial cells, the front surface layer on the cornea, a very thin layer of cells. We just remove it, and then after that we directly use our excimer laser to reshape the cornea. Okay, so after the procedure, the power is corrected, but because there is no flap to cover that raw area, well, in the case of the surface ablation, the healing time is a bit longer. And at the end of it, yes, you will still matter. And why is it that some patients have to undergo the advanced surface ablation without a flap? Well, it basically comes down to actually mainly to the thickness of your cornea. Sometimes if your cornea is not thick enough or your refractive power is too high, So we want to save the thickness of the cornea. So we'll take a bit of the corneal thickness away. So if you have a thin cornea and we want to do the procedure for you, we want to save the corneal tissue, then we just omit the flap. So if you omit the flap, you can have at least maybe like another extra 100 microns to correct your refractive error. Okay. So basically these are the two LASIK methods. One is without flap and the other one is actually with a flap here. I would say most cases they fall into this group here with a flap. Okay, unless you have, as I said, very thin corneas or very high refractive error, then no choice, you have to go for the one with the flap, without the flap, the advanced surface ablation. Okay, this is to show our Wavelight refractive suite. Basically, this is our LASIK system that we use in LEC Eye Centre. So this is obviously one of the most advanced LASIK systems in this region of the world. Okay, so what is it actually? The key points about this Wavelight refractive suite is that it is truly integrated system. Okay, now integrated, this is very important. Integrated system means that all components in this Wavelight refractive suite, all the different machines, all the different components, they are actually connected to each other by Wi-Fi. That means that when from the first machine itself, where you actually do all the eye measurements and the eye calculation, from the machine itself, all these figures, these numbers, this data, it will be transmitted by Wi-Fi to the subsequent machines, right up to the last machine itself, the laser machine, which is actually performing the correction on the eye. So the importance of this is that since all this information is relayed directly from the first machine to the last machine, there's actually no room for human error, because if not integrated, then obviously people will have to enter figures separately into each of these machines. So there is some room for human error there. So in this truly integrated system, everything goes directly, all data goes directly from the first machine right up to the last machine. So there's definitely no room for human error in the entry of the calculations and the measurements. Okay, and this the lasers used here are very fast. It's an ultra fast platform. The excimer laser is 500 hertz, and the femtosecond laser is even faster, it's 200 kilohertz. Okay, so all this means that your procedure can be completed very fast in just a matter of seconds. So this, of course, will increase the patient comfort and the anxiety level also, of course. And then this is, as I mentioned, the seamless data transfer within the WaveNet, okay, integrated network system. And then here we have a swivel bed. Swivel bed means this bed, basically for LASIK, we need two kinds of laser. One is the femtosecond laser, and the other one is your excimer laser. So the femtosecond laser creates your flap, okay? This is your femtosecond laser here, which creates a flap. And this is your excimer laser, which corrects your power, the refractive power. So in the first stage of the flap creation, the bed will be, where the patient is lying on will be on this side here, where the femtosecond needs to create a flap. After finishing the flap creation, the patient does not need to actually get up and walk to the next machine, because the bed will automatically just swivel over to the next machine. Okay. In some other systems, the patient actually has to get up and walk to the next machine, but for our system here, no. They just remain comfortably lying down, and the bed automatically swings over to the next laser machine, the excimer. Okay. So obviously, this is very comfortable for the patient. Okay, here I'm just going to give you a very a short video showing a live surgery, which of a LASIK surgery done at the LEC Eye Centre. Just wanna let me see if I can play this or not. Just wanna let me come out again. Okay, never mind. Okay, I'll go to the next slide first. Later, I'll try and get it to work first. Okay, so every procedure, of course, there's always some possible side effects. So same for LASIK. Okay, LASIK, of course, also has possible side effects. So what are the side effects? The most common side effects. Okay, first of all is dry eyes. Okay, dry eyes. Not many patients, sorry. Around maybe like 20% of patients, okay, sometimes they may complain of dry eyes. Usually it's not severe unless you have pre-existing severe dry eyes. Incidence is, as I mentioned, around 20%, and usually it will improve over 6 months to a year. Patients who before LASIK, they wear contact lenses. So contact lenses itself can cause dry eyes. So after you have done LASIK, you don't need to wear contact lenses anymore. So of course, that is actually a good thing for your dry eyes. So I would say these things, basically, they sort of like balance out and neutralize each other. So on the whole, just around like maybe 20% of them, they have dryness of the eyes, but usually by 6 months or a year, they're very comfortable already. Okay, the other thing which they may actually complain of is actually glare or starburst, especially at night when you're driving at night. Now, this incidence is actually up to 3%. And from our practice here, I can also tell from experience that, yes, this is a very infrequent complaint that we actually experience. And also, over time, it also improves and goes off. Okay, the other thing which may also happen, possible side effect, is something called corneal ectasia or corneal thinning. So this is actually, if you remember, LASIK is actually performed by applying the laser on your cornea. It removes some of the corneal tissue. So in a very small percentage of cases, 0.05% in fact, okay, in a very, very small percentage of patients, sometimes after the LASIK procedure, their cornea may undergo ectasia or progressive thinning. Okay, so this doesn't happen in everybody. The incidence itself is very low, and usually happens in certain predisposed individuals, like for example, young age, or they have very thin corneas, or the LASIK procedure, they have a very thin residual corneal bed. Okay, so that's why in our center, we actually our cutoff point for the corneal bed thickness is actually 300 microns. In some centers, they may accept 250 microns, but for us, we always go on the side of safety, so we always insist on at least a residual corneal bed of 300 microns. Okay, and some patients, they have very high power, high myopia, or they may have a form of a very early form of corneal disorder, which may not have been detected before the procedure. So this again tells us that the importance of a very good pre-operative screening for LASIK suitability. So that's why we do the things like the oculizer scan and all. That thing will actually help us to pick up things like early corneal disorders like this form thrust keratoconus. Okay? Because if you do not detect this corneal disorder here and you proceed with LASIK, as then they will have a higher likelihood to get this complication here, the corneal ectasia. Okay, corneal infection. Well, as with any kind of surgical, of course, there's always a risk of infection. Okay, infection, what we call infective keratitis. Well, for LASIK, this corneal infection, the risk is very, very low. It's only about maybe like 0.01 to 0.02%. Okay, in fact, actually, the risk of getting a corneal infection is actually even higher when you use contact lenses. Okay. So once again, I want to stress the incidence of side effects or complications. They are very markedly reduced with careful screening and exclusion of unsuitable candidates. So again, here I cannot emphasize more the importance of a proper pre-operative screening for LASIK suitability. Okay, just a bit more on the outcome of the LASIK. Okay, now many people around the world, many people, they have undergone LASIK, and actually there have been a series of questionnaires to assess the outcomes of LASIK. Some studies have been done. Okay, so these are the patient-reported outcomes with LASIK. Okay, PROWL studies. Okay, so this is a very famous study, and in this study, 99% of the patients who had LASIK, they had 6/6 vision or even better. 6/6 is actually normal vision. Better means actually it's better than normal. Okay, and 98% reported they were satisfied with the results of the surgery. Okay, that means they were really happy with the surgery. A small percentage, 3%, they had like glare, halo, starburst, which I mentioned earlier. And then another 20%, as I also mentioned earlier, they had some report of dry symptoms. But basically, all these symptoms by 6 months or a year, it's actually, it's more or less, it's already not there anymore. Okay, so this is about the LASIK procedure. Now, coming to the number 2, the second method to correct, the second method of glasses-free option is something called the Phakic intraocular lens. So if you remember just now I mentioned Phakic lenses means that these lenses are implanted into your eyes, which has still got the natural lens in it. Okay, so these are lenses which are surgically implanted into the eye. Okay, it's inside your eye. LASIK is a procedure done on the surface of your eye. It's not inside the eye, but this is actually phakic lenses. They're actually implanted into your eye to correct your refractive errors like short-sightedness and astigmatism. Okay, now why do we use this method, phakic lenses implanted? Okay, usually we use this method if the candidate or the person is not suitable for LASIK due to either the cornea is too thin corneas, or the power is too high. That means you need to remove too much corneal tissue to correct it. So if they're not suitable, then this is one option here, implantation of a lens into the eye. So this method can generally correct higher degrees than the LASIK. Okay, in general, roughly, I would say it can correct up to maybe like 20 diopters of short-sightedness. That's about layman what they call power 2000. Okay, and 4 diopters of astigmatism, or what they call in layman 400 power. Okay, 400 power of astigmatism. So this phakic intraocular lens, they're actually broadly divided into 2 types. One type, the lens is implanted here, right in front of your pupil, on your iris, in front of pupil here. The second type is implanted behind your pupil. See, this is your iris here, your pupil, and this square shaped thing, this is actually the lens which is put behind your pupil. So there are basically 2 groups here. One type is implanted in front, and one type is implanted behind your pupil. Okay, the one which is in front, if the doctor were to examine the eye with a microscope, they can actually see the lens. Whereas the one which is implanted behind the pupil, basically you can't really see the lens anywhere at the front of the eye. If you look at the center here, the pupil, using a microscope, if you focus carefully, maybe you can see that you can actually see the lens there, but you definitely cannot see other parts of the lens in front of your iris here. So there are many types of these lenses, the front type here and the one put behind the iris. Actually, there are many types. Here, I'm just giving 2 examples. The one in front here, this example I given is called an artisan lens. There are also other types, for example, the cachet lens, okay, which is also put in the front here. Okay, and here is example your pupil. This is called, in this example, I use the ICL. Other brands or other lenses, for example, the IPCL, the implantable contact lenses, okay, it's also implanted behind the pupil. So this is what we call your phakic intraocular lens. Lenses which are implanted into the eye on top of your existing natural lens here. Okay, this group here, this is totally different, or they want to correct their presbyopia. Presbyopia is what we call LOFA. LOFA means that your 40s onwards, many people, they will have problems focusing near objects or reading. Okay, so let's see. Let me go a bit further in this. So the medical term is presbyopia, commonly what we call LOFA. So this usually begins around 40 years when people start to have blurred vision for near. Okay, so LOFA affects your near vision. That means when you're reading or you're maybe working at the computer. So you see in this picture here, this is just an example to show you a representation. So in this patient here, this patient is in the LOFA age group. So they have still clear vision for distance. I mean, assuming they have not short-sighted or they don't have any sankong, then they're real near, they're close, their far vision, is still very clear. But when they look at the near things like their handphone, if they don't wear the reading glasses, you see everything is blur. So near is blur, but far is clear. So basically there's LOFA. Now, even if you have nearsightedness, if you have short-sightedness, many people think that, oh, I have short-sightedness. Usually some people say that if you have short-sightedness, you don't have LOFA. Okay, because basically if you don't wear glasses, you can use your short-sightedness to focus near and read. Okay, but if you have short-sightedness, you will still notice that your near vision blurs when you wear your glasses or contacts to correct your distance vision. So if you are in the LOFA age group, if you wear your distance glasses or your contact lenses to correct your short-sightedness, you'll find that, oh, your near vision becomes blurred. That means you do have LOFA. Okay, so what are the symptoms of this LOFA, presbyopia? So as I mentioned just now, the definition here is actually blurring of your near vision. Okay, it's only your near vision. And if you haven't started wearing these reading glasses, for example, this lady here, she's maybe coming around 40, and she's still wearing her distance glasses to correct her short-sightedness, okay? So she's wearing her distance glasses here to correct her short-sightedness. So these glasses, they are not multifocals. They don't correct LOFA. And she's already in the age group where she's starting to have LOFA. So when she wears her glasses, she doesn't have any short-sightedness because the glasses correct her short-sightedness. But when the short-sightedness is corrected, as a result, she will have LOFA now, okay? Because she cannot use her short-sightedness to look at the near things anymore. So now she is experiencing LOFA. So she has to, one of the symptoms is she has to hold reading material or the handphone further away. Because as I said, it affects your near vision. So if you have LOFA already, and if you try to hold the object further away to make it more distant, then yes, it may be clearer, okay? But eventually, in the end, when your LOFA is advanced enough, you will still need to get reading glasses because there's only a certain distance that your hand can stretch now. And if you put things too far away, the words also become too small. So in the end, it's still the same. You still have problem reading the fine print. So another symptom of this presbyopia is if you don't use glasses, then of course you have headache because you are trying to force your accommodating muscles to work to read the fine print. So headache, eye strain, fatigue on prolonged use of near vision. Okay, so these are symptoms of this presbyopia. Now, how to correct this presbyopia without glasses? That means what are glasses-free options? I don't want to wear LOFA. Okay. So basically, there are two methods I would say. First is also involving LASIK, but we do something called monovision LASIK. So in this monovision LASIK, both eyes undergo LASIK, but one eye, what we call your dominant eye, is corrected for distance vision. That means in your dominant eye, we correct your short-sightedness or your astigmatism, we correct it fully. Okay, that means you have very good distance vision. But the other eye, your non-dominant eye, we correct it in such a way that we leave behind maybe about 150 to 175, or in some cases even higher. We leave an amount of short-sightedness behind. So basically, you can use that non-dominant eye to see near or to read, because that eye will have a bit of short-sightedness, residual short-sightedness left behind. Okay, but mind you, this method, monovision LASIK, is it's only suitable in about 60% of people. Only 60% of people, they can tolerate this monovision system. Okay, so if you were to plan on offering monovision LASIK to a candidate, to a person, they will have to undergo very rigorous testing to make sure that they are suitable and they can tolerate or accept this visual system, monovision LASIK, or what they call blended vision. Okay, so sometimes you may need to put them on temporary on contact lenses. One eye is corrected fully for distance, the other eye is corrected with a bit of residual short-sightedness for near, and you may need them to actually wear for maybe at least a day or even a period of time. And so to make sure that they can really tolerate or accept this kind of vision. Okay. Then the other method to correct your presbyopia is actually this multifocal intraocular lens implantation. Okay. So this lens is actually implanted into the eye, but we have to remove your own natural lens first. So in the patient who undergoes this multifocal intraocular lens implantation, they can actually have what they call a clear lens exchange, or they can have cataract surgery, depending on whether there's any cataract or not in their eye. Okay, some patients, if they want to correct their presbyopia and they do not have any cataract yet, but they are sort of like maybe approaching the cataract age group, like maybe like late 40s, then they can actually choose to actually remove the clear lens and what they call it, straight away put in your multifocal intraocular lens. So this will solve all your short-sightedness, your astigmatism, and your presbyopia. And the other advantage is that if you undergo this surgery, that means your lens or the cataract has been removed. That means in future you will no longer need to undergo any further like cataract surgery, because the cataract or the lens has already been removed. Okay, since I mentioned cataract, maybe just a little bit here to let you know what is actually a cataract. So as you know, we have a natural lens inside the eye from the initial diagram I showed you. So cataract is actually opacification of the natural lens of the eye. Okay, usually the lens in the eye is actually very clear and transparent. Okay, sometimes the most common cause will be aging. Sometimes because of aging, the lens becomes less clear, becomes opaque. As in this picture, actually it shows a very, very advanced cataract. The whole lens has become opaque or so-called white cataract. So this is just to let you know what a cataract is. Okay, now the multifocal intraocular lens, the implantation of it is actually a surgical procedure. So I just want to let you see very fast, briefly, what the procedure entails. So in this procedure, it is called phacoemulsification. So what we do is a very small incision here, maybe 2.2 to 2.7 millimeters. A very small incision is made at the side of the cornea here. Okay, and then the what do you call it? The phacoemulsification probe, which is actually basically an ultrasound probe. This probe is actually applied to your cataract, and this probe will actually dissolve your cataract and at the same time aspirate or so-called suck it out. Okay, once the cataract has been completely removed, the intraocular lens is actually implanted into the same position, the original position that your cataract or your lens was. Okay, so this is a lens sitting nicely in your eye now. Okay, so this lens is in the original position of your natural lens of the eye or the cataract. Here it's actually this is showing what the lens actually looks like, the intraocular lens. So actually intraocular lenses, there are actually two types. So the one which I was mentioning earlier on to correct your LOFA and your short-sightedness and astigmatism, that kind is actually what we call multifocal. Okay, multifocal. You want to be truly glasses-free, this is the thing to go for, the multifocal intraocular lens. This corrects your near, your intermediate, as well as your far distance vision. So after this surgery, you should be completely glasses-free. Okay. The other type of intraocular lens is something called a monofocal. Monofocal, it is not completely glasses-free. Usually this lens, you can correct the vision for distance only. Okay. And the glasses will be required for reading. Basically, it corrects only vision for one distance only, either the far distance or the near distance. Usually, most patients, they would prefer to have their distance corrected and wear glasses for reading if they choose to have this monofocal type of implant. And for those patients who have, for people who have astigmatism, Sankong, yes, these lenses, they are also available in this toric version. Toric means that it can correct your astigmatism. So basically, this is the general shape of the lens here. This one here. Okay, it's not this big, of course. The optic or so-called the round part of the lens is probably around like a bit more than 5 millimeters only. That's all. Okay, one point here is that the refractive correction achieved by your pseudo-phakic intraocular lenses are permanent and are not expected to change with age. Okay, so this pseudo-phakic intraocular lenses, this is the lenses in the previous slide, just in the previous slide only. This is the lenses where you need to remove your natural lens or your cataract first before implanting. So this type of lenses, they correct your power permanently. That means as you age, the power is not going to change. You're not going to require glasses again later. Now, if you do refractive correction with LASIK or the phakic intraocular lenses, remember that LASIK and these phakic intraocular lenses, they are performed on eyes where the natural lens is still inside. So as long as your natural lens is still inside, as your age advances, you will be subject to development of LOFA or presbyopia later. When you hit your 40 or 40s, you find that you will still need to put on glasses again, the reading glasses. Okay, but a bit later on, as your age increases even more, then you will have cataract. And of course, if the cataract is mature or is obstructing your vision, then you will require another surgical procedure, the cataract surgery to remove the cataract. Okay, so these are the points that you have to consider. So LASIK or phakic intraocular lenses, that is only glasses free until your presbyopic age or until cataract develops. Okay, whereas your pseudophakic intraocular lenses, where you remove your lens, the natural lens and the cataract, the refractive correction is, I would say, permanent. Okay, so in summary here, okay, 3 groups I would say. Young, so-called young, no presbyopia, that means no LOFA. I think the way to go is probably LASIK. Okay, if they're not suitable for LASIK, then the next thing will be phakic intraocular lens. Okay, that means you implant the lens into an eye, but you still have your own natural lens in the eye. If you are like late 30s, like maybe 38 plus to mid 40s or a bit over mid 40s, but you don't have any cataract, but you definitely has got presbyopia or impending presbyopia, then the things to consider would be monovision LASIK, or you can even consider a multifocal intraocular lens. Okay, if you have no cataract, then it's called a clear lens exchange. If you have cataract, well, then there's no question about it. If you have a cataract, then you need to have cataract surgery, and you want to be glasses free, you can implant this multifocal lens, okay, which corrects your far, intermediate, and your near vision. Okay, so this is the end of my talk here. Thank you very much for your time. So if you have any questions, please feel free to ask.
Thank you, Dr. Lim.
Okay, okay.
Thank you. Okay, for the Zoom attendees, has anyone got any questions? Because we have tons of questions from the Facebook, our live chat room there. So I was just wondering if there's anyone in our Zoom have any question or not. No, then I will go through our Facebook questions. Okay, Dr. Lim?
Sure.
Okay, there's one question from Chai Tong Tong. Is LASIK considered a safe procedure?
Okay, LASIK, yes, I would consider it a safe procedure. In fact, in the recent years, the procedure has become even more safe. Because as I mentioned earlier in my talk, earlier on, I think the flap creation step that was done using the blade, where the doctor actually uses a microkeratome, manually creates a flap. Well, there's always an element of human error there. And of course, I would say if you were to create a flap manually like this, there should be a higher incidence of flap-related complications. But now in recent years, we do bladeless LASIK. That means the creation of the flap is actually completely using laser without the blade, and is controlled by a computer. So of course, a much higher margin of safety there. And the other thing about safety in this LASIK, to reduce complications, again, I must stress the importance of a very good pre-operative assessment to make sure that the candidate is really completely suitable for LASIK. Because if you were to perform LASIK on a candidate who is not suitable, then of course the risk of complications is actually very much higher. So yes, I would say LASIK is actually a very safe procedure if all those conditions are met.
Yeah, okay. And then another one would be, hi, Dr. Lim, does the power recurrence after LASIK?
Power recurrence, or what we call regression, yes, sometimes that does happen, but again, it is actually a very, very rare thing. And if it does happen, like if you have like before LASIK, you have like maybe 300-400 of power. When we talk about regression, if regression happens, you're not going to get back like 200-300 or 300-400 of power. Usually the amount of power that recurs is actually very low. And most of the time you can still have functional vision. But on the whole, the incidence of recurrence actually is very, very low. If the recurrence rate may be slightly higher in like people who have some predisposing criteria there, like maybe they have like very thin corneas, or they're very high power before the surgery. Yes, but in general, I would say yes, it's possible to have regression, but the incidence of it is really very, very low.
Okay, we have another one in our Zoom attendees, from our Zoom attendees, Lily. Lily asking, Dr. Lim, is lens implant or LASIK better? Which one more safe?
Well, if you ask me, I would say LASIK, because LASIK would be the first choice of this refractive correction, because LASIK is actually It's less invasive compared to your lens implantation. Lens implantation is where you actually need to go into the eye, as I mentioned earlier on. Okay, whereas LASIK is only done on the surface of the eye. And in general, also the procedure of LASIK, I would say, is the incidence of complication is I would say less than with the lens implantation. Not to say that the lens implantation has a high rate of incidence, but it's just relative or comparatively. Yeah, so I would say the first choice will be LASIK. If you're not suitable, then yes, you can proceed to the lens implantation.
As a second options.
Yes.
Right. Okay, Dr. Lim, I think this one, the question from Facebook asking, can a person who has reading problem LOFA is suitable for LASIK? I think just now you have elaborate, maybe you want to elaborate again.
Okay, sure. No
People who may just have LOFA, I think probably they need to have a better understanding.
Okay, if they have just LOFA, basically, but they have, they don't have any significant like short-sightedness. Basically, they have LOFA, but their distance vision is fine. Then, if they want to be free of this LOFA, again, I would say there are two options. The monovision LASIK, which they really have to undergo very rigorous testing to see whether they are suitable or not. In fact, a good candidate would be somebody who has some like short-sightedness, and they wear contact lenses, and all this while they have been adjusting their contact lenses in such a way to correct for their LOFA. That means one eye they will leave it a bit short-sighted, whereas the other eye they correct fully for distance. Some people, they actually know this trick with contact lenses. So if they have been doing this for years, I would say yes, they are a good candidate for monovision LASIK. But again, yes, sorry, I forgot the question here is from a person who has no short-sightedness, only the LOFA. Yes. Well, then, okay, then the two options are, yes, monovision LASIK, as I just mentioned, or the multifocal intraocular lens implantation.
But that would have to wait until you got cataract.
Yes, if you have cataract, then of course, definitely you have to go for the multifocal implantation. If you don't have cataract and you just want to correct your LOFA, yes, you can still undergo this procedure called the clear lens exchange. That means we remove your lens and then we implant the intraocular multifocal lens. So basically these two methods.
So just want to ask our Zoom attendees, anyone would have questions, you can either raise your hand to ask the questions directly with Dr. Lim, or you can actually put into the chats and then we will address to your question accordingly, okay? So Dr. Lim, Muhammad Ecuador from Facebook say hi to you.
Hi, hello, Muhammad.
And then Tam Siu Wei has one question. Okay, this is from Tam Siu Wei. How long do we need to wait to do sport activity after LASIK surgery?
Sport activities, okay. To be on the safe side, I would say like 3 to 4 weeks, probably a month. A month would be best, 1 month. Especially swimming, definitely no swimming before a month.
True. Because you would want to avoid any injuries and infections as well, right?
Infections, yes.
Yeah. And then we have another question from Tammy Low. Hi, Dr. Lim. Is it safe for a diabetic person to do LASIK?
Okay, unfortunately, actually, as I mentioned, one of the exclusion criteria is actually diabetes. Because we are probably a bit scared of like some improper wound healing and higher risk of infection. So I think, yes, probably not a good idea.
Okay. Another question is, the laser operation can last how long? So I presume is asking about LASIK.
Yeah, okay. Okay, the operation, of course, it will last. The power that has been corrected, it will last until, or rather the glasses-free state that you're in, it will last until, at least until you develop LOFA. So when you really have established LOFA, you will find that you will not be completely glasses-free anymore. You'll be glasses-free just for distance, but for reading, computer use, you will still need to put on a pair of glasses. So that will be usually like around 40 or 40s, early 40s or mid 40s. Then, of course, the next thing is that by the time you develop a cataract like 50s or above, then, of course, at that time is a whole different story. Cataract, early cataract itself can cause the power of the eye to be different again. And if the cataract is really advanced enough, then you will need cataract surgery to remove it.
I think in one of our live session, on the third day live session with you, Dr. Lim, I did ask, like, for someone who actually done LASIK at a younger age and then now develop cataract, they can still actually undergo for the cataract procedures.
Yes, they can.
Lens be used for a person whose distant vision is very good before the cataract?
Okay. Actually, yes, because this is actually one of the method to correct presbyopia in a person with completely no short-sightedness. That means in a person with good distance vision. So actually, this multifocal lens implantation, it can be done if you just want to correct your LOFA. So after the implantation of the lens, you will still have good distance vision, of course, but in addition, you will also have a very functional near vision. That means you will not need your reading glasses after that.
Okay. Tam Siwei have another question from Facebook. Do we still need to wear glasses after cataract surgery?
Okay. Well, this depends on what type of lens you choose to be implanted into the eye. If you were to go for the multifocal intraocular lens, then by right after surgery, you should be completely glasses free. If you just go for the monofocal intraocular lens, which I also mentioned just now, that kind of glasses corrects just one distance. Usually just corrects your distance vision. But for near vision, you will still need reading. As it depends on what lens you select to be implanted.
All right. Okay, before we continue with more questions, I would like to inform to all attendees, whether you're from our Zoom session or our Facebook live sessions attendees, all are entitled for a free eye screening and a consultation with Dr. Lim. So we will post the link into the chat, and then the link will be activated and valid till tomorrow 5 p.m. So you can actually do the registration for the free eye screening, entitled for the free eye screening later on. So we will post it in our Facebook as well as in our Zoom chat room. So you can actually, but this is only strictly by appointment. So once you fill in the form, and we will give you a call to arrange an appointment for you, all right? So next, I would like to announce our next webinar, which would be the 23rd of September, also on a Thursday at 8:30 p.m. by Dr. Umi. Right. So next webinar next month will be in a Bahasa version. What is the cause, and as well as the dry eyes problem. Okay. So that will be our next month session. So remember to follow and like our Facebook and our IG, so you can have more updates of our upcoming event. Okay, let me just double check any more questions. All right, Dr. Lim, I just want to ask you, this is actually, I think there's a lot of people may ask, does insurance cover for LASIK procedure?
As far as I know, a LASIK procedure is not covered because it's actually, they consider it as not a medical need, but rather cosmetic procedure. Yes, I think I think I may have heard of cases where somebody may have managed to actually claim it on the basis that they just cannot tolerate glasses, and the astigmatism is like making their life hell. But I can't really substantiate that. But in general, yes, I would say you can't claim for LASIK.
Totally agree. So, generally, in any of the medical insurance, they do not cover for LASIK procedures. Okay. What about Dr. Lim, if for those who have done the surgery, like any of the maybe LASIK or the pseudo-phakic intraocular lenses or the cataract procedures, can they actually like watch TV or look at their laptop or play their phone after the surgery? Is it safe to do that?
I would say it is safe. There's no issue. Yes, I know quite a lot of patients after all these surgical procedures, they're scared that they will damage their eyes, if they look at if they watch TV or try to read and all that. Well, actually, the act of watching TV or reading, it doesn't damage your eyes at all actually. But it's just that sometimes if the procedure is very recent, then your eyes may get tired faster, and the eyes may be a bit dry at the moment. So if you have to have prolonged visual activity, it may not feel very comfortable. So, but the actually doesn't damage the eyes.
Yes, those they say, I cannot watch TV,
they are so scared to watch TV, and then even in the house they wear sunglasses, which actually is not necessary.
I mean, I think it's safe. Like the indoor lightings are all actually pretty safe.
Yes,
right?
It's safe actually. The need to wear sunglasses actually the main purpose actually is to to let them see things comfortably, because in the immediate post-operative period, the eyes are quite sensitive to light. So when there's light, they may experience glare. So actually, that's the main reason we ask them to wear sunglasses, so that they can to have more comfortable vision. It's not that if they are suddenly exposed to the light from the TV, or if they happen to just suddenly walk out and forgot to put on the sunglasses, their eyes will get damaged. No, it's not like that actually. It's mainly for the comfort.
Right. And for those who actually done cataract, is it true that they cannot bend down forward like that?
Well, nowadays
we have patients asking, I eat, should I eat like that or I should eat like that?
Yes, I know. I do get that a lot. Well, actually, nowadays, I would say that most of the surgeries is actually done by using the phaco emulsification technique, which I mentioned just now, where the lens, actually the 5mm lens, is actually implanted through a 2-point-something millimeter opening in the eye. So the lens itself is actually bigger than the wound, the opening in the eye. So there's absolutely no question of bending down and then the lens so-called dropping out of the eye. Okay, because the lens is actually bigger than the wound of the eye. So there's no way if you bend down, something like this is going to happen. No. Maybe all this started last time when they were using the old method. They really have to use a knife and they have to really cut a big wound in the eye, to insert the lens. Because last time the lens was it's made of a more rigid or hard material. You can't fold it to half, make it smaller and insert into the eye through a small opening. So last time they really had to make a bigger wound, and then they have to stitch up or suture up the wound with maybe 5 to 7 stitches. So in those earlier days, yes, there is some possibility if you like to bend down and then get up and strain suddenly. Yes, there is a possibility maybe the iris may prolapse out through the wound, or the stitches in a very worst case, maybe the 1 or 2 stitches will give way. So maybe all this can't bend over. All this maybe it started from those days when they were using the older method to operate.
Probably the stitch wasn't stitched properly, right?
Yeah. Basically, because last time the wound was much bigger, and then it was held in place with very fine stitches. But nowadays, I don't think there's any issue like bending over and all that.
Okay, so any more questions from the attendees? I think today our Zoom attendees are pretty quiet, except for Lily. So if there's no more further questions, then we will call it for the night. And for those attendees who actually click the link to register for the free eye screening, you are also entitled for the free artificial tears pack. All right, it's actually sponsored by Sustain. So remember to click the link and register yourself for the free eye screening. Then you will also have the consultation by Dr. Lim as well. But it's strictly by appointment. We will call you to make an appointment for you. All right. So thank you, Dr. Lim. Thank you very much.
Thank you everyone for the time. Thank you very much.
Thank you everyone for spending your
Thank you, Dato'.
Thank you, Dato'.
Okay.
Thank you, everyone. Good night.
Good night, everybody. Good night.
Good night.